A research conducted by Infectious Disease Institute on the misconceptions regarding COVID-19 vaccination among people living with HIV from January to April 2022 reveals that the target population for vaccination was not willing to get vaccinated. This is because COVID-19 cases had reduced and people believed that the disease is no longer a threat.
Even if the HIV-infected people trusted us, the health workers, it was also evident that as the health workers lacked some of the basic COVID-related information, which would make us speak with authority and actually persuade and answer questions of the HIV-infected people when they ask.
The report further reveals that there was passive adherence to vaccination due to fear of being denied services.
If you don't continuously encourage them to be vaccinated, they may not be vaccinated.
Whereas vaccines are safe for persons living with HIV, some delays in administering vaccines at health centers discouraged people from taking their jabs.
So if somebody is a passive acceptor, he may not have the resilience to wait. It's not opposed to an active acceptor. An active adherent, somebody who's actively is looking, so he's willing to actually spend as much more time as possible because but if somebody, for example, is a passive, he's likely to actually lose patience and then move on.
There were also misconceptions of libido loss, abortion and infertility in the areas of Chitebi, Chiswa, Chisenyi, Komamboga and Kasangati where the research was conducted.
People say their bodies are weak. We don't yet know how vaccine will react with HIV and ART. Some of us are still taking our time, scared because we have heard of people dying after vaccination.
The findings from 767 persons living with HIV also showed that a large population believed that vaccination was beneficial.
72% of them were willing to be vaccinated. So they hadn't been vaccinated, but they were willing to be vaccinated, which is again an opportunity for the program.
HIV patients are most prone to suffer severe infections of COVID-19 if unable to access vaccines that help minimize severe attacks of COVID-19. Infectious Disease Institute recommends that health workers equip themselves with enough information about the vaccines in order to build confidence and interest the population to get vaccinated. Ivan Kahwa, UBC News in Kampala.
Thank you, Dr. Steven, for the wonderful remarks. Another round of applause.